Federal government says ASU not exempt from IPPIS payroll platform. Union officials walk out of meeting. SERP threatens to sue President Muhammadu Buhari if there is no move within 14 days to cut cost of governance. In international news, U.S. Food and Drug Administration grants emergency authorization for Regeneron antibody treatment for COVID-19. And in sport, FIFA bans CAF President Ahmad for financial misconduct.
This is ANN News.
I am Olajumoke Olatuji. The federal government has denied that lecturers in the Academic Staff Union of Nigerian Universities, ASU, have been exempted from enrolling on the Integrated Payroll and Personal Information System platform. An earlier report had said the federal government had offered ASU 65 billion naira and also exempted its lecturers from IPPIS enrollment to get the union to call off its strike. The federal government, in denying that report, said in a statement on Saturday by Minister of Labour and Employment Chris Ngige that there was no agreement at any meeting for ASU's exemption from the IPPIS platform. The minister said what was agreed at the last meeting with ASU representatives was that the union members who had not yet enrolled on IPPIS would be paid through the platform with which they received the president's COVID-19 compassionate payments in February and June. The minister said the government's position was being taken out of context. Labour union representatives walked out from a meeting with the federal government on Sunday, barely 5 minutes after it started. Trade Union Congress President Quadri Olaleye accused the federal government of dishonesty. He said the government was playing to the gallery and ridiculing organized labor before civil servants and the public. But the Nigerian Labour Congress says there is no strike option on the table at this time, following Sunday's unsuccessful meeting between the union and the federal government. President Muhammadu Buhari is getting an earful from the Socio-Economic Rights and Accountability Project, SERP, on the need to immediately cut the cost of governance as the country has entered a more serious recession. SERP says in light of this recession, considered the worst in decades, the president should put the country's resources at the services of the citizens so they would have the opportunity to enjoy a good standard of living. A letter to the president by SERP's director, Kolawole Oluwadare, says it is not too late to reorder the nation's steps to put its wealth and resources to work for the common good of all Nigerians. SERP threatened that if the president shows no effort within 14 days to cut spending on government and officials, it would take legal action against the administration. The country has been reeling under price hikes in several fronts. Recently, it was the increase in petrol pump price that has worried citizens. As Kelechi Mekalam reports, the pump price increase is pinching Nigerians in their wallets.
Sanitation worker Happy Michael reports at her duty post as early as 7 a.m. She commutes a distance 10 kilometers to work daily. The recent hike in fuel price has more than doubled her bus fare, forcing the mother of 6 to spend nearly half of her $65 monthly earning on transportation. What's left is barely enough to cater for other needs.
Fuel increase money. That is why driver they increase their own. We go market, we no fee buy food eat now. School fee for children, we no fee pay. Everything don't cost now, but they not increase our money.
It has affected every sector of the economy. Every other person is faced with reality of hardship because you must enter vehicle that will convey you from one place to the other. That is the first challenge that you are having. The goods, the commodities, everything, every product, it must have to be conveyed through means of transportation. And the means of transportation is also very bad because it's only motor transportation. How many rail do we have that convey those things? People and goods. There are no rail system, they are not functioning.
The 5.5% increase is coming barely 1 month after fuel prices went up by nearly 10%. Government has been increasing fuel price month on month after easing lockdown measures in September. The deregulation policy has been pointed out as one of the reasons behind the recent price hikes.
So what has happened is that the government has moved from complete regulation of the oil price to partial regulation, managing the floor price, to now complete regulation. So now saying, okay, let the market determine the price. We are getting to the point now that the private sector are coming in with their own capacity. And you cannot tell somebody who goes and borrows money to come and rely on subsidy that the government doesn't have money to pay. So you have to allow some reasonable degree of market price to enable the people who borrowed to be able to recover their costs.
The government of these days, they are not doing well. Because when this man came into power, he told us that it was going to be a refinery. But now what we are seeing here is different from the promise that our government gave us before they came to power.
Despite being Africa's largest oil producer, Nigeria's refining capacity is very low. It hasn't exceeded 30% in the past 5 years, as its refineries are dated, and the nation depends largely on its crude for swap deals. Government says it hopes to revamp its refineries by 2023, but until then, the current forces surrounding the fuel export market will continue to determine the cost.
Nigeria Center for Disease Control (NCDC) has announced on Sunday night 155 new coronavirus infections in 11 states. NCDC says the new figures now pushes up the total number of COVID-19 confirmed cases in the country to 66,383. As usual, Lagos led with 60 cases, while Katsina came second with 37 infections. Kaduna State came third with 35 cases. The agency reports 192 patients have recovered, while 1 fatality was recorded across the country as of Saturday. 62,076 patients have so far been discharged, and 1,167 deaths have been recorded in 36 states and the Federal Capital Territory. The agency has also warned Nigerians to stay away from using antibiotics to treat COVID-19 because they only work for bacterial infections, not viruses like COVID-19.
Coming up, African stories. UNHCR says humanitarian efforts in Ethiopia's Tigray region has worsened. And later, international news. U.S. Food and Drug Administration grants emergency authorization for Regeneron antibody treatment for COVID-19.
You are watching ANN.
Welcome back. This is ANN News. Ethiopian Prime Minister Abiy Ahmed said late last week the final offensive in the Tigray region will be completed in the coming days. Government forces and those of the Tigray People's Liberation Front, the political party that governs Tigray, have been locked and fighting for almost 2 weeks. Correspondent Girum Chala reports.
What the Ethiopian government calls a law enforcement mission in its northern region of Tigray is now almost 2 weeks old. It is said the nation's army is on its final heavy offensive against the TPLF.
The mission of upholding the law and sovereignty is ongoing at the moment, strengthened more than the days before. The unfaithful group is facing the strong arms of the National Defense Forces, and the law enforcement measures are particularly being taken on the rogue force by avoiding as much as possible any civilian casualties. The mission now is gaining a number of victories in all battlefields and will continue this until the group surrenders for the constitutional order.
And already people have come out on the streets across the country to show support and respect for the National Defense Forces. The office of Prime Minister Abiy Ahmed says the rally is seen as a huge morale boost for the army.
This 2-minute activity, which entailed standing in honor for the National Defense Forces and also giving them a morale boost and encouraging them that the Ethiopian people are behind them, are supporting them, and are also supporting the finalization of this rule of law operation with the minimum impact to civilians. But this is planned, or the whole rule of law operation is planned with the perspective of bringing lasting peace and stability to Ethiopia, particularly within the Tigray region, as well as all other regions in the country.
Communication and power remain largely cut off in the Tigray regional state, and it's almost impossible to gain tangible information from that area. The international community as well as neighboring states still are calling for the resolution of the conflict in Ethiopia through dialogue. Such repeated calls are now being made by the UN, the African Union, and neighboring states such as Kenya and Sudan. Ethiopian authorities, however, say the effort of finding solutions through peaceful means has expired, and such an effort won't return until the mission of law enforcement ends successfully.
The United Nations High Commissioner for Refugees, UNHCR representative in Ethiopia, Anne Enkostra, says humanitarian situation in northern Ethiopia's Tigray regional state has deteriorated rapidly since the armed conflict broke out in the state earlier this month. In an online interview, Ekontra says with the deterioration of the humanitarian situation, Tigray's humanitarian aid operations are in trouble.
The electricity has been off. There has been a communications blackout practically everywhere in the region. And of course, banking services have stopped. Food supplies are very, very minimal if they haven't run out in the markets. But because of the general confusion and problems with the armed conflict, people can't move around as freely as they would like to. All the humanitarian workers are affected because there's no freedom of movement.
And Contre pointed out also that the armed conflict has stopped the locals from focusing on the COVID-19 epidemic prevention and control, which has become another crisis for the state. For Zimbabweans moms-to-be, pregnancy can be an exciting time. Information from the Centers for Disease Control and Prevention shows expectant mothers anywhere are also more likely to face complications if they contract COVID-19. But in Zimbabwe, there is added problem of expectant mothers having access to necessary critical care as the rate of skilled attendance has decreased to 20%. Correspondent Faraya Wokosuya reports.
When COVID-19 broke out in Zimbabwe, health workers, like many other people, were fearful of the new disease. The uncertainty around the pandemic resulted in disruptions to service delivery.
I think initially when someone got infected, we would say close the facility, and then until maybe we get to the bottom of what has happened.
That cut off expectant mothers' access to critical care.
Initially, about 75% of Zimbabwean women used to deliver under skilled attendants. In other words, under a qualified service provider. Whether it's a midwife, whether it's a doctor, whether it's a nurse who is not a midwife, but is qualified care. But this went down from 75% skilled attendants. We were probably getting about 20% skilled attendants.
Which led to an increase in home deliveries.
There used to be hospitals providing cesarean sections for difficult births. But then with COVID now, getting transport to get to the hospital was a problem. So what happened? A number of women were struggling to give birth. And by the time they arrive in hospitals, they actually are fatal. They die.
A health sector strike made matters worse. Almost all of Harare's 42 municipal clinics ground to a halt in July. City of Harare says service has since resumed at 70% of them. But some, like this one behind me, are still closed, meaning women who need to access maternal services here have to travel far to access them. Despite this, the city attended to more pregnant women and more deliveries. Really, our antenatal care numbers have gone up this year. Actually, figures, when we looked at our figures up to the end of September, we are up by 25% from what we anticipated, which is up 25% from last year's values. That's the same as well as institutional deliveries that are happening within our facilities. While COVID-19 imperiled many lives, it's also led to innovation in reaching pregnant women in rural areas.
Because they couldn't get to the facilities, we look for the food distribution center, where the health providers of that district will be there that day to also assess nutrition and piggyback some of the maternal health services.
Taking maternity services to women and helping pregnant women access maternity waiting homes could save many lives until the pandemic is brought under control.
When we return, international news. U.S. Food and Drug Administration grants emergency authorization for Regeneron antibody treatment for COVID-19. And later, sport. FIFA bans CAF President Ahmad Ahmad for financial misconduct.
You are watching ANN.
Whether in your house, at your office, on your phone or online, we are there. We have the facts behind the headlines. We cut to the chase with the news you really need. We cover every angle. We are the bigger, better news network. We are African News Network. ANN. Watch ANN News on MITV from a truly African spirit.
Welcome back. This is ANN News. The U.S. Food and Drug Administration has granted emergency authorization for the Regeneron antibody treatment, the same drug that was administered to President Donald Trump after he was diagnosed with COVID-19. The drug's approval is limited in scope for people who have tested positive for the coronavirus and who are at high risk for developing severe COVID-19. Regeneron says it will have enough of the drug for at least 80,000 patients by the end of this month. It says by the first week of January, it would have enough for 200,000 patients and for 300,000 by the end of January. The United States has surpassed the 12 million infection mark and nearly 270 Americans have died from complications from the disease. The U.S. restaurant industry, which has been decimated over the months by the ravaging COVID-19 pandemic, is again being chilled by a new stay-at-home order to stem the fast-rising and very deadly coronavirus. As correspondent Dan Williams reports, the new order is causing a blow to restaurants that have just begun to rise from the ruins of earlier lockdown orders.
The leafy Chicago suburb of Winnetka, nestled next to Lake Michigan and known locally as the filming location for the movie Home Alone. It is also home to 501 Local, a restaurant that opened just before the pandemic began.
Can I have a cauliflower soup? It's almost like it's a comedy sometimes, because it's like, what else can happen to us? You know what I mean? So obviously it's been very difficult.
Illinois has joined other regions in once again imposing a ban on indoor dining. The order means the outlay on indoor dining safety equipment, like plexiglass, now seems premature at best. With a harsh Chicago winter on the horizon, the owners of this restaurant decided to invest in these greenhouses, or pods, as a way to stay open.
Those greenhouses are really cool. I mean, I think that's going to be probably the thing that people remember about us for the winter. They're ventilated. We clean them after each use, sanitize and stuff like that. But it's a cool way to just get out and have something different.
The owners of this restaurant, as well as many others across the country, have gone to extraordinary lengths in an attempt to keep their doors open. But as winter approaches, some experts believe more needs to be done in order to save the restaurant industry.
The pandemic has already accounted for the permanent closure of dozens of restaurants in Chicago.
The combination of more disease and less safe options is going to be devastating for the restaurant industry. So it speaks in my mind to the need for the government to see this as an industry that should be supported, because their closure is the sacrifice for all of us, and so we should be helping out that restaurant industry.
Back at 501 Local, the owners remain hopeful the measures they have taken will see them through the winter.
It's not going to be a pretty winter. I mean, I'm not going to lie about it, but we're going to definitely make it for sure.
Others in Chicago and across the country won't be as lucky.
The city of Tokyo, Japan, has raised its coronavirus alerts to the highest level. Late last week, as its daily tally of new infections rose to a record 534. Its governor has called for maximum caution as the year-end party season approaches.
Despite days of record-breaking COVID-19 numbers, the Tokyo metropolitan government has yet to announce any concrete measures to curb the spread of the virus. In fact, Tokyo's Governor Yuriko Koike simply pleaded with residents to act with more caution when they go outside. She's asking residents to gather in groups of 4 or less, speak quietly at restaurants, and of course make their outings as quick as possible. But beyond that, no stay-at-home measures and no asking businesses to close their doors early or at all. Now, a similar story for the federal government. They say Japan as a whole is on its maximum alert level, but they have not announced any concrete plans to ask people to stay at home or otherwise. A lot of experts have been pointing to the government's domestic travel subsidy program for further spreading the virus, but the Prime Minister announced that that program will not be put on hold. He's simply asking people to act with more caution when using the subsidies.
Up next, sport. FIFA bans CAF President Ahmad Ahmad for 5 years for financial misconduct. Please stay with us.
You are watching ANN.
We are on the road every day, canvassing throughout Africa for news you really need. We follow this story everywhere, from every corner of Nigeria to the wide African expanse. We bring you what's making headlines. We connect you with news you can use. ANN, African News Network, in a truly African spirit.
Welcome back. This is ANN News. In sport, FIFA has selected 2 Nigerian referees among the 156 referees to officiate at the 2023 Women's World Cup to be hosted by Australia and New Zealand. This would be the 9th edition of the tournament and would be played in 12 cities across both countries starting from July next year. The embattled president of the Confederation of African Football, CAF, Ahmad Ahmad, who doubles as FIFA's vice president, has been banned for 5 years over financial misappropriation. A 60-year-old from Madagascar was found guilty of breaching FIFA's code of ethics. He is alleged to have gone against duty of loyalty, offering and accepting gifts or other benefits, abuse of position, as well as misappropriation of funds. That's ANN News this evening. Thank you for joining us. For details on these and other breaking stories, visit our website, annafrica.news. Conversation continues on our social media platforms, Twitter, Instagram, and Facebook at ANN Africa TV. I am Olajumoke Olatunji. Have a pleasant evening.